Hi, it's Dr. Centeno, and I'd like to go over today, should you get a Quickie bone marrow stem cell procedure? Now, there are stem cells in your bone marrow, and these can be isolated and concentrated to get bigger numbers. And this is accomplished using a centrifuge, which spins the whole bone marrow. Result of this isolation is called bone marrow concentrate, which is a stem cell rich cocktail, or BMC for short. Now, there's a new trend for some physicians to use this fancy device to pull bone marrow aspirate out and then just re-inject it without centrifuging. The company that makes this device, which is called Marrow Solutions, claims that it can obtain the same or greater number of stem cells without concentrating bone marrow in a centrifuge. Now, this would be pretty cool if it were true. So we tested this device in our Advanced Research Lab against the usual device and bone marrow concentrate. And regrettably, what we found was that the Marrow Solutions device failed to produce as many stem cells as bone marrow concentrate. In fact, it wasn't even close, and it was no better than a traditional trocar used in the same way. Others who have also tested this have confirmed these same research findings. So why is this a problem if you've got fewer stem cells? The early research on bone marrow stem cell treatment demonstrates that you need a minimum number of stem or other cells to get the best outcome. In fact, off to the right there is from one of our research papers showing that we needed a minimum of 400 million total nucleated cells to get a good outcome in knee arthritis. And there's another big problem for this Marrow Solutions device, because all of the world's research on how stem cells can help orthopedic problems has used bone marrow concentrate, not the stuff that this Marrow Solutions device produces. And that means that we don't have a clue whether or not this thing works, but we do know that bone marrow concentrate works in many instances. Hence, if you get a Quickie stem cell procedure, you may be reducing your odds of a positive outcome because that Quickie procedure will likely have fewer stem cells than if you got a bone marrow concentrate procedure. Now, how would you know if you're getting a Quickie procedure? The doctor will take the bone marrow out and then re-inject it right back in the same surgical procedure. So to find out more about this stuff, see regenetics.com. And at this juncture, without more research, I say you should go for a bone marrow concentrate procedure and not one of these Quickie marrow procedures. Thanks so much for watching and have a great day.